So first off, what's your name?
Kristen.
Hey, Kristen. Okay, so we're trying to get some information, just your feedback on what do you do every day to keep patients safe from CLABSI?
Well, every day, if we have a patient who does have a central line, every day in rounds, we do make sure that we bring up the fact that they have a central line, whether we still need the central line, any issues we have with the central line. And I guess that's what we do every single day. Yeah.
What are the ways in which you, at the bedside, as an RN, have owned the process of preventing CLABSI in the CCU?
I think the nurses in the CCU are very protective of their central lines. We don't like anyone else touching them but us. Doctors drawing labs off them, like we'd rather do it ourselves. And we don't usually draw labs off of them. I think that's one of the things that we do. If they want to draw labs, we try to avoid it as much as possible because we don't like to access them if we don't have to.
How do you communicate that if somebody wants to access a line?
We'll be like, well, have we tried to stick them? And if it's been like they can't get the labs and they need to, we'll be like, well, the cap change is due tomorrow. We're going to be accessing it anyway. So can we wait until then, or do you need these labs now?
How has your unit pulled together around a common goal to reduce CLABSI? What do you do as teamwork?
I think we always pass on to each other and report and make sure that we keep up to date our Epic flow sheet of when lines and caps and everything is due, so that things don't get missed.
Right. And what advice would you give to other units wanting to decrease their rates of CLABSI?
I just think if they all band together and become protective of their lines, and I think our big thing is we really try not to access them. So I would say try to use as least number of accesses as possible, even if we have sometimes meds that are only twice a day. If they're already hooked up to something in their other lumen, we'll always leave a carrier anyway, just to avoid those two accesses. So I think that's it.
Any other advice for other?
I don't think so.
Cool. All right, that was perfect.
Thank you.
Thank you. See, easy peasy.